Hi, everyone. Thank you so much for taking the time to watch my presentation. I hope you enjoy. My name is Nazgol Rahmani, and I currently live in Vancouver on the unceded traditional and ancestral territories of the Musqueam, Squamish, and Tsleil-Waututh nations. With support from my practicum supervisor, Dr. Lex Vitas, and my practicum instructor, Dr. Jeff Masuda, I was able to complete my practicum with the Vancouver Aboriginal Health Society's dental clinic. There I completed several deliverables, the primary of which was a program plan development aimed at improving access to dental care for Indigenous peoples on the Lower Mainland. So first I'll go into the whys, why I chose this particular practicum placement and subsequent project. As many of my peers may know, I've had a passion for dentistry for quite a while now, and this has translated into numerous papers and projects focused on the issues and interventions related to the oral health sector. I hope to continue this trend throughout my practicum, and so the opportunity to work at the VAHS Dental Clinic, which is the clinic with the lowest barriers to access of all 19 active non-for-profit dental clinics in the Lower Mainland, seemed like an amazing opportunity and a perfect combination of my two passions, oral health and public health. It is not a surprise that the state of oral health in Canada is subpar, to say the least. A pro-rate system where those with the least need for care are most likely to be able to access services has resulted in significant disparities. The oral health component of the Canadian Health Measures Survey identified that 1 out of 3 Canadians has a need and 1 out of 6 cannot address said need due to financial reasons. It has even been found that while Canada ranks similarly to other industrialized countries with regards to several measures which indicate good oral health, it does rank as one of the poorest performers of all OECD countries with regards to dental visits, where pro-rate inequity is very large. These inequities are especially apparent for marginalized communities, including low-income individuals, seniors, refugees, and Indigenous peoples. The target population of this program plan is Indigenous peoples, particularly as the host organization was the Vancouver Aboriginal Health Society. The First Nations Oral Health Survey found that First Nations have some of the highest rates of early childhood caries, higher prevalence of malocclusion, and higher treatment needs compared to their non-Indigenous counterparts. Indigenous peoples deal with many stressors and barriers in the healthcare system, and the oral health system is no different. Factors such as approach of healthcare providers, cultural differences, past experiences with the system, and racism all contribute to hesitancy using oral health resources and services. With this in mind, I wanted to identify a project which addressed these shortcomings of the sector and focused on the population which the clinic is meant to cater to the most. As many of my peers have found, just over 3 months is much shorter than expected, so time, resources, and a myriad of other factors had to be taken into consideration when the project was defined. So I'll now go into my practicum deliverables, and I've broken it down between my 2 main projects and my smaller deliverables done throughout the term. My larger deliverables consisted of a grant application to the Vancouver Foundation and a program plan development following the Center for Disease Control and Prevention's multi-step program planning framework. The grant application was introduced very early on into the practicum while I was still getting a feel for the organization, the shortcomings, and the potential areas for growth. Nonetheless, the grant was written and was aimed at answering the question, what barriers are currently preventing urban Indigenous peoples from accessing oral health resources and services in Metro Vancouver? The grant application consisted of several long answer questions related to the challenge being addressed, the proposed process being taken, a public statement, and a short literature review. This was the ideal jumping off point for the focus of my program plan development, where I defined my goal as being to improve access and increase utilization of VAHS dental services for Indigenous peoples in the Lower Mainland. As for my smaller deliverables, there were several shortcomings of the clinic discussed that were potential public health hazards. So throughout the practicum, I worked alongside staff to address these issues. One of which was an emergency plan development following Prepared BC's resources. All the informational resources provided to volunteers, staff, and dentists, as well as the website, were also updated. It was ensured that the resources and the site were cohesive and represented the society with their mandate in mind. Now I'll dive a bit deeper into my program plan development, which accounted for the majority of my time in my practicum. As I mentioned, I followed the CDC's multi-step program planning framework as a guide for my program development, but best efforts were made to ensure that reconciliation was at the forefront of the planning process. I utilized the Canadian Institute of Planners policy on planning practice and reconciliation as a guiding framework, but ultimately planning is an iterative process. So the goal is that as the program is being implemented, collaboration with Indigenous peoples, both as researchers and patients, occurs such that findings are representative of the community and that Indigenous peoples feel empowered about their own health. As I mentioned, the goal of the program plan was outlined as being to improve access and increase utilization of VHS dental services for Indigenous peoples in the Lower Mainland. And it should be noted that while this goal primarily addressed the downstream interventions at the access to service level, there is room for growth into mid and upstream interventions, which address the micro and macro policy levels, respectively. SMART criteria pictured on the slide were employed to determine short, medium, and long-term objectives, which gave a clear picture of what the program would entail over the next several years if implemented. And going back to feasibility, the intervention selected was a health education program aimed at addressing the contributing factor of lack of knowledge of services available, which was identified as both an important and modifiable factor. The goal is that as the word spreads of services available for Indigenous peoples, both through the non-insured health benefits program, as well as through services provided by non-for-profits such as the VHS Dental Clinic, more people will become aware of their rights and services available to them, and over time, fewer emergencies will occur due to a combination of preventative and restorative treatments. Not only will this be beneficial for patients, but it will also reduce the strain of emergency cases entering the healthcare system. An implementation plan was devised that consisted of a work and communication plan. The work plan was outlined to ensure that the program will achieve its short, medium, and long-term objectives in a timely manner. And the communication plan was written to organize how progress will be tracked, allowing for stakeholders and staff to remain informed during all stages of the program. And finally, a plan for evaluation was written to ensure accountability of the program, and the evaluation was utilization focused to ensure that decision-making is facilitated amongst those who will directly use the evaluation findings. So with all that in mind, the next logical step is to ask what this means for the sector. For the clinic, a program such as this one would mean an increased proportion of patients entering and accessing services. Not only will this be beneficial in widening the scope of people using oral health services, but it will also indicate to governing bodies how necessary non-for-profits are in this predominantly private sector. As for myself, the completion of this practicum and project was an amazing learning opportunity and my first experience working in a public health setting. Being immersed in a non-for-profit clinic allowed me to see firsthand the shortcomings of the sector and gave me the opportunity to discuss with professionals in the field about improvements that can be made. I'm hoping that as I continue working in the oral health sector in any capacity, I can emphasize treatment services and programs which prevent rather than treat. Not only will this be beneficial for patients' health, but it'll also almost always be more cost effective as well. Lastly, a program such as this one, as well as any other similar programs aimed at improving access to oral health services, will hopefully begin to shift the sector from a reactive to more proactive and predictive. And by this, I mean prevention will be at the forefront of services available, and an emphasis can be placed on restorative rather than emergency treatments. So thank you so much for listening to my presentation. I hope I was able to shed light on an important and somewhat overlooked public health priority. Please keep oral health and its implications in mind every day as we're moving closer towards universal dental care. We as public health professionals can strive to improve the sector and address gaps as they arise. If you have any questions or comments, I'd be happy to hear.